Welcome to Quad A Now, where we explore the world of patient safety, the impact of accreditation, and other topics relevant to outpatient healthcare facilities and dental practices. Join us as we explore diverse topics, share success stories, and navigate the challenges that define the pursuit of excellence in patient safety.
Welcome to the Quad A Now podcast. I'm your host, Tom Terranova, CEO of Quad A. Today's guest is Dr. Renato Saltz, a board-certified plastic surgeon based in Salt Lake City, Utah. Dr. Saltz is a leader in aesthetic surgery, having served as past president of the International Society of Aesthetic Plastic Surgery and the American Society for Aesthetic Plastic Surgery. He is an adjunct professor at the University of Utah and a clinical professor in Brazil, with over 500 lectures and 100 published articles to his name. As a pioneer in endoscopic facial surgery, Dr. Saltz has made significant contributions to facial aesthetics, body contouring, and breast reconstruction. He's the founder of the Image Reborn Foundation, which supports breast cancer survivors, and he runs Spa Vitoria, the first medical spa in the Intermountain West. Dr. Saltz has been featured in numerous national media outlets, including Extra and major publications like the New York Times, Wall Street Journal, and Allure. Let's dive into today's conversation with Dr. Saltz. Thank you for being with us today. I know you're very busy. You had a long day of clinic today, and so I really appreciate your time to be with us today.
Thank you, Tom. Thank you for the opportunity. We have a long-standing friendship through Quad A, through ABAM, through so many meetings. You've always been a great friend and a great servant of plastic surgery and patient safety. Thank you.
I appreciate it. Thank you. So, speaking of being a servant of patient safety, I know that one of your favorite books and one of your favorite methodologies is servant leadership. So I think that's a great segue into your history. And I know you're incredibly passionate about patient safety and leading your colleagues in plastic surgery, but in medicine in general, to always do things the right way. I guess as a starting point, could you tell us a little bit about your professional journey and what led you to this calling of sort of serving medicine by serving patient safety?
Well, I appreciate that question because nobody asked me that. But the very first decision to come and train in the U.S. was based on better training, better safety. I finished medical school in 1980, and the training at that point in my native country of Brazil did not include much of general surgery. And I always thought to be a complete surgeon, especially a safe surgeon, you need to be trained in general surgeon. So I did all the tests that were necessary at the time, and I was very lucky. I was accepted for my general surgery residency at the University of Miami, Jackson Memorial Hospital, and I was there for 5 years. I got my full training in general surgery. I was a chief resident. At the time, was one of the busiest programs in the country, if not in the world. Remember, in the 80s, Miami was not such a beautiful, fancy place it is today. We had Miami Vice, we had Pablo Escobar, we had the riots, we had the bad Cubans coming in the Mariel boats. So it was not a great place to live, but it was a wonderful place to train. And I'm so blessed and lucky to be able to do that. And again, in surgery, as you know, Tom, you credential surgical facilities, you know surgeons. The more you do something, the better you train, the safer you're going to be. So after that, I joined. I was accepted at the plastic surgery program at University of Alabama under Lou Asconez and Jim Grotting. Again, very, very lucky to have those two amazing surgeons and doctors to train me. And I spent an extra year doing microsurgery training there and serving as a junior faculty. So when I tell people I was really focused on patient safety, that goes back to even my medical school. We wrote the very first and perhaps the only paper at the time in one of the busiest ER centers in the city that I went to medical school, which was the capital of the most southern state of Brazil, Porto Alegre. And we look at the safety of that emergency room center that served over 1.5 million, 2 million people. And the results were not very wonderful, and they tried to block us from publishing. Not only we published at the Brazilian Journal of Plastic Surgery, but we also was accepted for presentation at many meetings. So as you can see, it's not a new thing. It's been with me since my medical school back in the late 70s, and something that I'm very lucky, and I feel very responsible to do that at every society, every organization I belong to.
I think it's interesting because there's a couple things that you said in there that are I've heard as common themes from some of our faculty, some of our board members, some of our longstanding physicians. And one is, where I trained wasn't necessarily the best city to live in. It was a little bit volatile, we'll say. And that's usually, like you said, the people who got the most exposure to the most dynamic cases, maybe the most trauma cases. And it wound up being whether you're in Baltimore or New York or Miami or probably, Chicago in the 80s and LA, certainly, it made for interesting training. And I think a lot of practice for the people who trained there. And the other thing that I found very interesting, what you were saying, is sort of the idea that when you went to study sort of the outcomes in your native state, that there was a little bit of pressure not to publish the data, because I think we all value transparency, but there's a scary part to transparency, and especially in medicine, things that require data reporting and transparency for the institutions can be scary, because I think there's an assumption that it might undermine confidence in the care. But Quad A's kind of philosophy is that that's really what builds the trust in the care and allows us to advance. As we've collected data since 2001 and we publish with researchers, we always are under that same pressure. Maybe do we really have to say that? Do we really have to talk about that complication? But the truth is we do, because that's the only way we advance. And so I commend you for taking that on in 1980 and 1985 and 1990, when people were probably way less eager to be as transparent as they have to be today.
The funny thing, I went back to that, like I said, one of the largest ER centers in South Brazil, and actually there was an impact. They modified their protocols. They modified how they did things, and maybe because of pressure, maybe because they're embarrassed, it works. So the right. Patients benefit somehow. So that's my sort of philosophy in life. You put pressure, sometimes people don't like it, but at the end, it's a good thing. And, we make as physicians, we joke around, especially plastic surgeons, but we made an oath, and we're here for the patients. And it doesn't matter if you're doing aesthetics, if you're injecting a filler or neurotoxins, and that you should never forget that. And something that I tell, the residents from University of Utah, they rotate with us every month, and I keep hammering that, and some look at me and say, what is he talking about? But you have to remind physicians, especially aesthetic physicians, we're so removed from the real medicine. We are on the Instagram, we're looking at our likes, it's a different world of aesthetics. And we're here because we're physicians first. We're here because we're surgeons second. We're here because we're plastic surgeons third. And it's something that I heard one time Robert Singer mentioning in a presentation, and we never talk about it, but it makes total sense to me.
I love that. I think that's great, because I do think that the commodity that plastic and aesthetic surgery has become, creates so many different pressures between patients, because they're more cost conscious, because this is not going to be covered by insurance of any kind, and it's going to be out of pocket. So I'm going to act more like a consumer than as a patient. And that sort of pushes doctors to work more as a service provider as opposed to as physician. And as you said, reorienting yourself every day to say to yourself and to your patient and to your staff, we're here to provide medicine. The aesthetic part of it doesn't matter as much as the medicine, the surgery, and the care of the patient. And I think we sort of talk about that internally, that, one of our, obviously plastic surgeons is among the highest population, the number of facilities that we accredit. And when I joined Quad A in 2009, I think it was somewhere in the 90% of what we accredited was plastic and aesthetic surgery. And now I think it's about 40 something percent of what we accredit. And it's not because the plastic surgeons have gone away. It's because other specialties have also joined the ranks of the accredited facilities, which is great. But, we sort of used to joke internally and say, if we're making the world safer for someone going through endoscopic procedure, or we're making care safer for an orthopedic procedure, or we're making care safer for a tummy tuck or a liposuction, it's still making someone who's on the table safer. And people can treat plastic and aesthetic surgery as something less important because maybe it's not seen as serious as a cardiac case or something like that. But someone's still going under anesthesia and going under the knife or having a pretty invasive procedure, and to impact safety in any way in a positive manner is I think critical to kind of knowing who we are when we do this work as accrediting and certainly as a surgeon.
100%. I think when a patient has a complication, it's a complication.
Yeah.
A patient, the way some people see aesthetic surgery is sort of a very light, very superficial specialty. Some of our procedures can actually kill you.
Yeah.
And look at the evolution. I mean, I'm old. Look at the evolution of the learning of DVT and PE in abdominoplasty.
Right.
It's fantastic. I remember we used to keep those patients several days in a hospital and wrap their legs with ace bandages and walk them. Look how much we learn about that disease. Now we can, potentially prevent almost 100% of the problems. And we know through many protocols when not to do it and when to do it in a safe way. And they do great. Yeah. And we don't see, thank God, board-certified plastic surgeons don't see many of the disasters we saw in the 60s, 70s, and 80s because we learned through science. We respect abdominoplasty and other procedures as potential very serious procedures with potential lethal complications. Science prevail, and today you can do those operations in a much safer way. So, no, you're absolutely right. Aesthetic surgery is no different than any of the other specialties. And God forbidden, you're having a complication, a totally elective case, to me, is much more serious than in a trauma case, in a cancer case, in a congenital case.
Right.
So I take that very, very seriously. I only operate in hospitals. I'm very paranoid about everything. I told you I was in Mexico this weekend for the Mexican Society meeting in Puerto Vallarta, and I show one of my favorite books is Andy Grove's Only the Paranoid Survive. And people say, what? And I said, let me explain to you. And, his famous quote, success brings complacency, complacency brings failure, only the paranoid survive.
Right.
And it's so true. You start being complacent in the operating room because you've done 1,000 facelifts. Boom, there comes the hematoma to remind you. There comes a facial paralysis to remind you, and you gotta be vigilant and paranoid and respect the patient. That's a patient right in front of you.
Yeah, I think you said it really spot on too, and why I think plastic surgery and aesthetic especially is in a unique position because obviously, it's a completely elective case. It's typically a pretty healthy patient by and large. And so, it's not only the tragedy of human loss or destabilized life in some way because they've been affected by it, but it's also sort of attention grabbing. And that's what brings in headlines and pressure and all these other things because, when somebody has a bowel perforation on a 78-year-old patient doing a GI procedure, it's not as shocking and stark or things like that. And it doesn't grab the imagination and the headline like something that happens to a 28 or a 30-year-old otherwise healthy person that chose to have an aesthetic procedure. So I agree with you. I think the idea of sort of being purposefully paranoid, even that's an attention grabbing, statement, because diligence is really what we're talking about. But diligence is something that everyone thinks, yeah, I'm diligent, but
I'm diligent. Yeah.
But to say I'm paranoid is very purposeful.
It gets your attention.
Yeah, absolutely.
Attention.
So, but when you're talking about a lot of really interesting things, you're talking about studies, you're talking about, you're talking to the Mexican Society, and, what we learned through science and what we've published. And throughout your career, you've been on the boards and on the leadership and on the sort of the line of succession or led just about every professional society there is, including the Aesthetic Society here in the U.S., including ISAPS, the International Society for Aesthetic Plastic Surgery. Obviously, we have a pretty close relationship with both organizations, but those organizations existed before Quad A, and they do a lot outside of Quad A. So I'm curious if you can kind of speak to your experience leading these organizations and sort of anything that you're particularly proud of as far as accomplishments or initiatives that drove the ball forward in terms of patient safety to your colleagues spread throughout the U.S. and then through ISAPS throughout the world.
Well, there's so many things, but so many people have done wonderful things. I'm not the one that's going to tell you Renato this, Renato that. I think the focus of both societies have been on patient safety from day one, as you pointed out. The fact that plastic surgeons in the United States can only operate in an accredited facility, I think that's terrific. As you know, we made a huge effort. You are more involved than I am right now because I'm past president of ISAPS. But that was an effort of many, many years trying to get the same concept to that organization. And I think we're still making strides. It's hard because you have 106, 110 countries, different cultures, different languages. Some cannot get along. Some don't understand each other. And here comes Tom Terranova and Renato and their committee trying to establish this global accreditation program. It's very hard. And I always say, when you look at the United Nations and why people can get along, when you transfer that to an international society, it's hard. And they all have great intentions. Everybody wants to do the right thing. So I applaud Quad A and your patience with that program. But it's still, I was there with the current president of ISAPS, the president-elect, Arturo Montanana, Vakis Contois, all good friends of yours. And we talk about, guys, don't forget the Global Accreditation Program. Push patient safety. We're going to have a session on patient safety in Singapore, our annual meeting there. And in ASAPS has done, the Aesthetic Society they have done so many programs on patient safety. The first, you're going to laugh at this, the first course at the Aesthetic Society, ASAPS, on patient safety was given by Mark Jewell and myself. And we had just a few people in the room. But, that was over 20 years ago.
Yeah.
So you can never relax. Now we have other issues that at the time, our concern was just plastic surgeons. Now we're concerned about nurse practitioners. We're concerned about the dentists. We're concerned about extenders. There are non-surgeons, non-physicians doing liposuction in Salt Lake City. I mean, how crazy is that?
Wow.
So I think all physicians, there are many, many physicians involved in this. I think it's extremely important, and that really define us as physicians and surgeons.
Something you said really struck a chord with me because you've had the experience of speaking a lot about surgery and technical stuff and science, and you speak about patient safety, obviously. But when you're giving, when you're teaching a cadaver class or when you're teaching a technique and you're showing your results, there's a lot of interest there. And you mentioned that when you and Mark Jewell gave the first talk, there was a couple people in the room, and I've been there. I've given those talks, and it's interesting to me that surgeons, by and large, are incredibly conscientious. and they are really well-meaning, as you said, whether it's a national society or an international society. Everyone comes to the table meaning well, and the minute you put a talk on a podium about patient safety, it's like the lights turn off and one guy shows up and you're speaking to someone sweeping in the back of the room. And I've thought a lot about this, and I think it comes down to the fact that to be a surgeon, to be a plastic surgeon, you have to be pretty darn confident in your abilities and what you can do. And you've learned confidence and you've learned technique and you've learned all these things. And, when we're going to speak about patient safety, most of the doctors at that point think, I'm safe, I'm diligent, I'm conscientious, I do well, I know what I'm doing. And I really need to go learn this new technique so that I'm at the cutting edge. I know how to be safe. I learned in med school, my residency, all these other things. And that's where it's really, you struck the chord with me, because I thought of being at some of the meetings and speaking to a room of 3 or 4. And we've sort of taken a new approach to it, where we're approaching it like, run your business more efficiently, run your practice more efficiently, more responsibly, be a better leader, talk about everything around the surgeon. Because typically when we're talking patient safety, we're talking about everything other than the surgeon. The societies, the Aesthetic Society, ISAPS, ASPS, they're continuing the education of being a better doctor, a better surgeon, technically, and through the science. We're talking about all the operations and the procedures that go on around it. So we're talking about efficiency and best practices, and that seems to get a lot more attention. But man, when you said speaking to a room of 1 or 2 people, I had some flashbacks.
It's very interesting. And we're both going to Austin for the aesthetic meeting this week. On Sunday noon, there will be a panel on complications of facial surgery. And for Nahai, your past board member, I don't know if he's still on your board.
Past president.
Past president, and some other distinguished faculty will be on that end. I'm one of the panelists. So I said, what should I do? What should I do to make this different? I just hate to show the same slides over and over. So I went to AI. I went to ChatGPT and I said, tell me some quotes from surgeons about complications. Do they care? Do they talk about their complications? So one of the quotes that came out is something that I always heard about it, but I didn't know it came from Sir William Osler, who is the father of modern medicine, modern surgery. And he was at McGill, and then he became chair at Johns Hopkins. I mean, he's done everything. And it's his quote that said, maybe I'm not telling you exactly, but a surgeon that does not have complications is a surgeon that does not operate.
What?
And I said, I can't believe we always talk about this jokingly. This came from a real guy, the guy that contributed more than anyone else in history. So I thought that was fascinating. So I'm going to open my talk. If you're there on Sunday, you're going to see, I'm going to open my talk with that, because it's so true. It's so true. And you're still here, Tom. We go to these amazing meetings and some big names, very distinguished colleagues that, this technique, I had no problems. I've done, come on, give me a break.
Well, so, I stand at the back of the room because I'm not a physician, and I can observe, and I've been around this for 15 or so years, but I stand at the back of the room and I watch, and what I find the most fascinating is usually when one of the big names stands up and the first part of the presentation is, I really struggled with this, or I had a hard time managing this patient, or I had a bad outcome. Everyone else sits up. That's the most engagement you can get, because if they had a problem, I don't need to be as bashful about my
100%.
problem. And now we can start talking, real.
100%. You're absolutely right. You're absolutely right.
I think it's fantastic. And really one of the venues where I think that happens really well is a perfect segue is to ABAM. I mean, as I said, you've led just about every society there is, but ABAM is not a society, it's a meeting. It's the American Brazilian Aesthetic Meeting. One of the most interesting groups. I think it's one of the most interesting meetings because it's so intimate and small, and everyone really gets to meet with each other and spend really a lot of quality time. So you go a lot deeper than you would in most of the big society meetings. And I'm just curious, I know you started ABAM, so how did it come to be? Like, what did you see as the specific benefit of creating this meeting?
Well, Tom, and you appreciate this more than most because you have ties with Italy, you have ties with Europe. Like I have very strong ties with Brazil, my native country. As a foreign medical graduate, it's very hard, one, to get a position in residency in this country. You have to take all these tests and everything. And
in a foreign language.
You have another language. It makes it much harder. And, it's a different culture. You have to adapt. And thank God I was able to, because I love America. I'm probably your number one ambassador in plastic surgery of the United States. But I thought a lot about there's so much value out there and how hard it is to get one of these foreign colleagues to get have podium time in the U.S. It's hard to get I'm talking about 20 years ago.
Sure.
It has become a lot easier, more open, but it was hard. And I said, how can I have an impact on this? I'm known, everybody knows me. So if I put a group together and open this door, open this opportunity for foreign colleagues, foreign plastic surgeons, some young, some very senior, to show their work. In that little ABM audience, there's some amazing leaders of American societies or international societies. And that's exactly what happened. I had that vision. I had no idea it was going to work so well. But some of the big names, some of the international big names, first presented right here in Park City. And many of them. And today they are leaders. They are running sessions. They became leaders because they had an opportunity to present in the U.S. They went back. In their countries now, they had an opportunity to lead because they learned things how we practice in the U.S., safety measures in the U.S. They set up those protocols in their countries. It has really brought our societies together. I think we had a little impact on that, which makes me very proud because overall we helped everyone. That was the number one reason that meeting was started. And so now it's all in Park City. It's much easier for me to put a meeting together in my backyard and all the way down in Brazil. I have a terrific group of scientific advisors. And we, like you said, we have this very friendly, high-level scientific community. And they love the meeting. They contribute a lot. And now each one of them is bringing their young colleagues and referring their young colleagues to ABAM. So I love that. I love that continuity, and this is going to be our 18th year. And the second component that you know very well, I never took one dime out of ABAM. We paid the expenses, and we paid the meeting coordinator. We pay AV. I negotiate every single thing because I want to save money that is donated to the Image Reborn Foundation. So I call it a meeting with a mission. And the reason I do that is twofold. One, obviously to help Image Reborn, because I think plastic surgeons, our core training is in reconstructive surgery. I really believe to be a great aesthetic surgeon, you need to have training in a great career in reconstruction first. That's one. Breast cancer is very, very close to all of us. 1 out of 8 women will develop breast cancer during their lifetime. So we're all surrounded by breast cancer, either among our patients, in our families. My mom developed breast cancer at 91 years of age. And it's going to hit you either as a professional or as a person. And I think also created a sense that I see many of my colleagues that never really care about service leadership, about being a servant. They get it now. and I learn a lot from them, and they are learning a lot from this little meeting. So it has many aspects that make me very, very happy, and I keep pushing ABAM to improve science, to improve patient safety. As you know, you've always been invited. Some of your board members have been invited. One of your past presidents and past board member is part of my advisory board and scientific advisory board. And ABAM has done that in a way. It has helped international and perhaps even our national societies to look into that aspect. Servant leadership is now a term that I hear a lot in other boards that I participate. And I give the little book to every board member at ISAPS, ASAPS, every new president at those societies get to read the book. So I think that's a minor contribution to a better aesthetic plastic surgery world, hopefully.
I couldn't agree more. Like I really do think ABAM is probably, it's at least the best meeting that I like to attend because of the intimacy, even though it's smaller. You know, anytime if you're going to exhibit, obviously you want big, huge meetings. But the truth is, you know, some people walk by, they're in a hurry to get to 15 different sessions. But at the ABAM meeting, you're sort of a family for 4 or 5 days. And there's all the social events, and there's all the fun events, and there's all those great things. But there's a lot of really good work going on. And it's those, you know, few hundred people in an intimate setting every day, having deeper conversations, which I think leads to some of that more impact that you spoke about. I mean, we've, I think, presented 4 or 5 different times there, maybe more if you count, you know, kind of multiple talks at the same event. And you can see follow-up. Then when I go to ISAPS or I go to another meeting, someone that I talked to at ABAM in depth hasn't forgotten about it because now we've spent, you know, 2 evenings together talking about this concept, and then they come back to it when I see them wherever else I am. And you were mentioning sort of your colleagues from all over. And I don't want to miss Image Reborn because that's the part of this that makes me the most excited. But you mentioned some of your colleagues from all over the world. And ABAM, I think, you're going to have to change the name just to mean ABAM instead of the American-Brazilian meeting, because it's not just Americans and Brazilians anymore. I think you were either very fortunate or very wise to start with the 2 largest societies in the world, as far as I know. But then, I mean, you know, I'm struck by how many folks come from really all corners of the globe. And, you know, I think I've seen pretty much every country in Latin America represented, most of Europe. I think last year was the first time I had seen a couple attendees from Kenya. And so there's a lot more representation than just American Brazilian. So you're going to have to be like British Petroleum just going to BP, and you're just going to have to be ABAM soon.
It's so funny you mentioned that, because the Turkish complain, the Mexicans complain, the French complain. We're better skiers. We're more French here than Brazilians. I mean, yeah. And my meeting coordinator has been hitting me on this because she wants to brand as something, and I don't know what to do. Maybe you're smarter than I am. Somebody has to come up with I don't know what to do. But
well, you don't want to lose those 20 years of recognition and equity that ABAM already has.
Yeah.
Well, you know, speaking of that impact and that brand equity and that mission that you really spoke about, you talked about Image Reborn. So our audience, I'm assuming, and from the statistics we have, you know, it's starting with accredited facilities, mainly plastic surgeons. But my hope and my sincere wish is that we start speaking a lot more to patients, because I think you've heard me say it before. I think, you know, I won't say we as a medical community. I'll say I'm not part of the medical community. I'm a medical community adjacent. But I think surgeons do such a wonderful job of getting into a room and talking about quality and talking about safety and being places at 5 a.m. to learn a new technique 35 years into a career in a way that most of us don't do in other careers. But I don't know that the public knows it. So one of my hopes and one of my missions with this podcast and a lot of what Quad A is trying to do is really starts to speak to the patients, because being a member of a society, to a patient, if they're not really thinking about it, could be just like joining a club. I don't think that they always know that it means that you're up at 5 a.m. in Istanbul watching a cadaver lab happening around the world to learn a new technique and to always try to be better. So I'm hoping that we're educating patients in so many ways. And one of the ways I want to do that in the conversation with you is to talk more about Image Reborn, because I think what ABAM does by being essentially a nonprofit meeting and turning all of the proceeds over to Image Reborn, in addition to the other ways that you're involved in Image Reborn, is really inspirational. So I wonder if you could just talk a little bit about Image Reborn. Obviously, you talked about breast cancer being so close to all of us, which it really is. But if you talk about kind of how ABAM feeds Image Reborn, what Image Reborn really does, what are their activities, and sort of summing up, I know you've given the statistics every year at ABAM of how many women Image Reborn has served, but for your colleagues who've never gotten to hear that wonderful presentation, who've never gotten to meet Bobby, who've never been to the gala, and also to the public, I wonder if you could introduce them to Image Reborn and all the good work that you guys are doing.
Oh, that's thank you so much for doing this, Tom, because one thing I totally agree with you, for Quad A to reach out to the patients, because it's going to grow exponentially. And I would love to have a patient coming to me and say, Dr. Saltz, I heard you operate at the hospital because it's safer. Or I heard you work on an accredited facility because I learned Quad A. That's what they do. Once it gets to the community, then it's wonderful, because then there's no question we reach our clients, which is not the plastic surgeon, is really ultimately the patient. That's why we're here. So I was in charge. I always had this fascination for reconstructive surgery. My 8th year in training, I was doing a lot of breast cancer reconstruction. I was doing a lot of free flaps at University of Alabama during my last year there. And when I moved to Medical College Georgia and then University of Utah, I was in charge of all the breast cancer reconstruction, which is a very important, very broad area in our practices. And despite having all the training, despite having achieving very good results, I always found those patients extremely sad. I always found those patients not celebrating with us when we look at symmetry, when we look at perfect match after an extensive reconstructive procedure. Me and my nurses are all giving high fives, and the patient in front of me, they were sad. It was like, what's wrong with you? Don't you get? This is a beautiful result. I can go and present at my meetings. I'll write a paper. My chapter looks great. And the patients, the ultimate individuals that should benefit from that, they were still very sad. It's almost like the result did not affect them. They didn't share that happiness we had with the results of the reconstruction. So one day, the nurse that used to help me at University of Utah in my breast cancer clinic, and I was doing this for 10 years, developed bilateral breast cancer. And I saw her going down the drains. I saw her getting depressed. I did her reconstruction. She looked amazing. I did a bilateral breast reconstruction with tissue expanders and breast implants, and she looked amazing. And I kept telling Pam, you look great. Why now you look and sound like our patients? What's wrong with you? And it was not until she went to a fly fishing retreat up in Montana. And when she came back, she said, Renato, that's it. I spent the weekend with several other breast cancer survivors. I get it now. I'm happy. I know what I'm dealing with. I have the tools to deal with all the other problems that I have at home with my spouse, with my kids, with all the other issues that as reconstructive surgeon, we had no idea. And she said, that's what we're going to do. We're going to send our patients to Montana for flight. I said, no way. We live in this beautiful city of Park City. We're going to do these retreats right here. And that was the beginning of Image Reborn retreats. We started in late 1998. And those days we didn't, I was putting our own money to get the retreats. We're relying on a lot of great donors to let us use their homes. And as you know, there are plenty of beautiful second homes here. We reach them out by letter, we reach them out through the park record. And these individuals were amazing. They let us use their homes for our 3-day retreats. And that was the magic thing, Tom. I learned very quickly, once you put these women together, you bring a facilitator in, you let them spend time together, most of the issues are going to vent. And as you know, Tom, women, it takes 5 minutes. They are best friends. You try to do that with men, will take maybe a year if that ever happens.
Right.
And we modify the agenda. We learn how to improve them. We kept modifying and separating. A stage 4 survivor is different than a 25-year-old survivor. Stage 1, a Hispanic survivor is a completely different issue than a very healthy adventure survivor. So we start separating by groups, and I think we almost perfected that. We're close to 40 retreat years now. We have retreats in Park City, in St. George, in Denver, Colorado, in Houston, Texas. We're now having our 3rd retreat in Florida. We had in April going to have a retreat in Puerto Rico. We have an offer to do a retreat in Canada. It's finally expanding and serving more and more breast cancer survivors. It's really fascinating.
When you talk about a retreat can be a lot of things, and I know what the Image Reborn retreats are, but I wonder if you could speak to kind of the holistic approach that Image Reborn takes, because again, as you said, a lot of the surgeons who are listening to this are thinking about the measurables and the science and the quantifiables, and to know that all of this other stuff that's really the magic of what brings these women back to kind of their normal state, or maybe even better than before they went into surgery. That's the other stuff that is part of the retreat, and it's really interesting to me what all goes into that.
First of all, it's all free. And if you cannot make it to Utah, we'll send you a ticket. We'll fly you into Utah. If you have children and you cannot leave, a lot of them have young children. And another reason, they don't have time to take care of themselves. And as you know, these patients go from doctor to doctors. Our goal is to get the cancer out, chemo, radiation, reconstruction. They are lost in this whole thing. Of course, we all want to do the right thing, the best thing. We want to help them, but patients don't understand. Many don't have the time to deal with the disease. They think they're gonna die. So we bring them in on Friday early afternoon. They start coming to. We like to have between 8 to 10 to 12. We had early on, we had retreats with 20 people. It didn't work. So we narrowed down. We know exactly the number that it is effective, efficient. So they come in early afternoon. We have a terrific army of volunteers. Many are past attendees. Many just volunteer. So we pick them up at the airport. We drive them to these homes. And then they start getting to know each other. So Friday is pretty much a getting to know each other. By Friday evening, they're already best friends. They're already sharing a lot of their breast issues. They know each other. They cry together. They do journaling. We bring a chef on Friday night. We bring another chef on Saturday night, all paid. So they get education, what's good to eat, what's not good to eat. Obviously, the presentations are different for a stage 4 disease than for a young survivors under 30. Some groups need a priest. Some groups need a preacher to teach them how to deal with death. A very advanced stage 4 group And I'll tell you my role in all these retreats. It's a very sad retreat. So we try to coach them. We try to teach them how to accept death, how to deal with their family issues, how some don't have a will. We teach them how to do that. They have massages. They go out and go to local restaurants. We have a very good partnership with firefighters in Park City. So they come, they visit the station, they learn things what the firefighters do. Estheticians coming to do skincare. We have yoga masters coming in. We have physical therapists coming in. We try to customize the retreats based on the attendees. We have surveys, we have information about them. We have people coming in and talk about wigs, talking about bras and how to adjust your bras for if you had a mastectomy, how to fill that with a fake boob. And from the very beginning, I wanted to have some component of plastic surgery. I said, I don't want this to become medical retreats because they are boring. This is not what they need. So we created the medical hour. And if I'm in town, I'm the one that do medical hour. I come in on Sundays. I always tell people, those are my best Sundays because I spend 2.5 hours we talk about surgery. We talk about problems they have, scar tissue, keloids, hair loss, and other symptoms after chemotherapy. My burn after radiation, how do I manage that? I make it very, very open. They share things with me. If I think they're not getting proper care, I'm going to find them another surgeon. I'm going to find another oncologist. Obviously, it's all HIPAA. It's all confidential. But I'm there every Sunday. Now we're close to 40 retreats, so it's a very busy foundation and in many different places. So the Hispanic retreats, Hispanic culture, they don't talk about cancer as you and I do. It's a very hush-hush thing. I don't know if the right word, but they are ashamed. They were very quiet. So we deal with that. The facilitator is a Hispanic survivor. It's all in Spanish, the whole weekend. The medical hour is in Spanish. And, we pass over 4,000 breast cancer survivors attending our retreats. Like I said, many want to give back. So many give back to the foundation. Many become volunteers. Susan Faltison decided to pass retreat attendee, came to Utah a couple times. Now she runs her own retreats in Denver, and she became a board member. So it's amazing what women, they get it done. They're not
right.
Not
if
as
you put your mind to it,
complicated.
it's over with. Yeah.
They're not complicated as we are. They get stuff done, and they are amazing.
Yeah, I think what I find the most interesting, it's sort of there's a very common theme that there's sort of like the self-care as therapy kind of aspect of it, right? Like, by and large, they're getting good treatment, they're getting good care, their physicians are looking after them, but it's all the other stuff, like you said, just even thinking about my wife, moms, that it's at 10 minutes before bed is the only time that she's really got to herself, right? And so if you're a survivor and you're worrying about your small children and what they're going to eat and how you're going to take care of them, you're not taking time for yourself. And so these women going to that place where there's 3-4 days where everyone's just there to focus on you, to let you focus on you, and to kind of commiserate and share with one another, I think is got to be sort of hugely powerful and transformational to the women. And I've talked to some of the survivors that you've had at some of the events, and it really is incredible, like sort of how they can describe coming from, I was well cared for, and I got my reconstruction, and I was technically okay, but I wasn't really okay. And it wasn't until after I went through the yoga and learning how to eat a different way, because now you're breaking 40, 50, 60 years of bad eating habits to try to care for yourself in light of your condition. And so you have to, learn something new and sort of all of those different things that build up the psychology and the emotion that kind of support the medicine and support the person to go on. So, I'm super excited every time we get to engage with Image Reborn at all. I know last year, I think it was, that I met with Bobby, and she said, we really want to make sure that we go to as many states as we can. And so, I got real ambitious and said, I know a lot of folks at a lot of the national societies, and I'm going to push them, and I'm going to try to get them to get luncheons in every state and raise money. So if I was speaking in my, kind of pie in the sky ideal scenario, I could see every plastic surgery society in every state coming together, holding a luncheon, holding a one-day fundraiser, and putting together enough resources to support a retreat in their state for their own patients and constituents. And so I won't go as far as Robert Singer did and bang my head on the podium and issue a challenge, but I will say to any plastic surgeons out there listening, consider putting together some sort of fundraiser, a luncheon, an event, and figuring out how you can host a retreat in your state annually. I know, I think it was Texas. There was one surgeon who donated the entire retreat. It's much more approachable than you may think if you're out there listening. It's much more approachable to put one on, and the impact it has on the patients, I can tell you, from my firsthand experience with them, is just life altering. So I'll issue the not the challenge, but the invitation on your behalf as a third party who just wants to see the good work continue and grow.
I appreciate your words, and I appreciate your action. I think that's a brilliant idea. I won't do that. You know me well, but so in Florida was the Dr. Albert and his wife Lena, and they said, Renato, we want to open one in Florida. He set up a fundraising in his office, which was wonderful because he practiced in Boca Raton, so there are a lot of people attending, made some money, and boom, that's how we started retreats in Florida. And God bless them, because there are a lot of breast cancer in Florida. They don't need to fly all the way to Utah. So that's my whole point. Yeah.
Right. I'm pushing a plug for it. So if someone listening somewhere who wants to get involved, who would they contact, or where would they go to learn about how they could either find a way to volunteer, how they could donate, or how they could, conceivably put on a retreat of their own? Who would they contact to start to figure out the logistics of that?
They can contact me right away. I can give you my cell phone. I can give you my email. Everybody has it at rsaltz@saltzbreastsurgery.com. That's my personal email. It's easy to remember. And then I will, I'll pass them on to Bobby or Allie. We have a wonderful, you met them, we have a wonderful staff. We have a terrific, hard-working board of directors. We have an advisory board of directors with some very prominent names. Industry has embraced. We have several companies. They come to the gala every year. They donate. So we're very lucky. The community has, the plastic surgery community, industry, members, societies have embraced. Last year we had Mark Theis and Courtney coming to our gala. Sue Dykma is a member of our advisory board for years. We have Allergan, we have Benev, we have Softwave. We have so many companies that have donated at the high level, and that's what keeps our retreats going.
Yeah, and I think, if I'm not wrong, this year you hit a pretty big milestone in terms of donations, right?
Yeah. So every year at the gala, and Tom, please join us October 18 at the beautiful Stein Erickson Lodge. At the gala, ABEM donates a check. So whatever we made last year, I always leave some in the bank so I can start marketing ABEM for the following year. But we have been donating for many years. And this last year, we donated $100,000. So we gave a check presentation. So at this point, ABEM has donated $850,000 to Image Reborn. and that has helped a lot. ABM has become the number one donor to the foundation. So I'm very, very happy to share that. I'm very proud of my colleagues that come to ABM, and they all know, and they keep coming back to ABM. They know where the money goes, and they contribute a lot scientifically, and as a good people they are.
That's incredible, and I think it's a testament to all your hard work. And again, I'll invite people to look for Image Reborn on the internet, to contact Dr. Saltz and figure out how to get involved and how to support these women, because it really is a great event. You know, all charities are good charities, but there's some that are hold a special place. And I think whenever they say one out of 3 women is affected in some way by breast cancer, so I think I hope I have that right. I wish it was lower, but I think I have that right. But you know, everyone is pretty much touched by it, so this is something that's kind of close to all of us. And so get involved some way or another is what I would say.
And look at you. You are CEO of a accreditation company for patient safety, and here you are running this podcast, helping Image Reborn. I really appreciate that. You're a very special person. It must be your Italian-American blood there that makes it so special. And, you know, when Italy and Brazil play soccer, we don't, Tom and I don't talk. But
we're not allowed to talk, yeah.
But they are both not doing very well lately. So
it's true. It's true. So I know you're, again, very busy after a long day of working. But, you know, you had a lot of foresight to when you came to the States and started to train and started studying patient safety. You had a lot of foresight when you put ABAM together. So you're clearly clairvoyant and you can see the future. You've worked with Quad A, you've worked with the Aesthetic Society, you've worked with ISAPS to promote patient safety in the US and globally. What do you think is sort of the next frontier, whether it's plastics, whether it's aesthetics, in your sort of universe? What's the next frontier in raising patient awareness and patient safety as you go forward?
I think, Tom, is it on the non-surgicals. I think is on the med spa world. I think you hit the nail on the head when you call us for, I don't remember how many months ago, and said, we need to start thinking how to credentialing med spas, because that's a world that we have no really understanding. It has grown too fast. Our societies have no control of it. Plastic surgeons have no control of it. We're just a very, very small number here. And I think the steps that you took to put the task force together, work on a credentialing space and protocols to hit that space is fantastic. And I've been to some of the calls. I review all the protocols that the group has been working on it. And I think if we could, if and I know you will, but if we could set up protocols and credential med spas, would save a lot of people. Nobody's dying, but people are getting hurt. And I think could be an amazing contribution from you as a CEO, from your organization, and from all of us involved to get that space a little bit under better control. I think that would have a tremendous repercussion in the media, among patients. You know, I would love to have patients coming in and say, Dr. Saltz, is your med spa credentialed by Quad A? I think when we see that happening, and it's going to start with plastic surgeons, because that's what we are, the group that understands Quad A, understands patient safety, understands credentialing. But if I do it, my community will follow, because we set the standards. And I think that's your legacy. That's Quad A legacy in this crazy world of non-surgicals, cosmetic medicine, and med spas.
Well, I think we'll certainly continue to deal with BBLs for a few more years and the fallout there. But I think their patients have become much more aware of the risks, and they're becoming, I hope, a little bit more circumspect. But I think, you know, to your point, you know, earlier about plastic surgery and aesthetic surgery kind of being seen as not as serious, I think the same dynamic is probably being amplified in med spas. And it's not to denigrate any of the people who are doing it now. It's just to make sure that we have consistency and standardization. I mean, as an accrediting organization, we publish standards for a reason, because we're trying to standardize the care to the point that a patient can predict that they're going to be in a safe environment with practitioners who focus on safety. That doesn't mean nothing will ever go wrong, because as you said, a surgeon who doesn't have complications isn't operating, but you want to minimize that, and you want to take all the precautions you can to make sure that the patients are safe. So I do appreciate your perspective on that.
Thank you so much, Tom. Thank you for what you're doing, to your board of directors. I know you deal with a lot of individuals and surgeons, and it's not always easy, but your leadership has been incredible. We met when you joined Quad A, and Robert Singer, Fu and High. You were surrounded by great people. So congratulations.
Well, thank you very much. Thank you for taking so much time out of your busy evening, or at least your evening after a busy day. I hope I haven't kept you from Flavia for too long. But I will thank you for your time this evening. And thank you also to our listeners for tuning in to this episode of Quad A Now Podcast. If you have questions or feedback, we'd love to hear from you. Visit us at quada.org/contact us. So it's QUADA.org/contact-us. And be sure to follow us on LinkedIn, Facebook, Instagram, and X at Quad A Now. Don't forget to subscribe to the Quad A Now podcast for more engaging conversations with leading experts like Dr. Saltz. Join us next time as we continue to explore the critical roles of accreditation, innovation, and all other things having to do with patient safety. Until then, stay informed, stay safe, and we'll talk to you soon. Thank you.
That's a wrap on another enlightening episode of Quad A Now, a global accreditation podcast. Stay tuned for more captivating discussions with leaders who are shaping the landscape of quality and patient safety. Remember, patients first, always.